are going to be sharing their expertise with you. But before we get started, I just have a couple notes that I want to share. One, we have an awesome turnout of people on the call. We just hit 900 participants that have joined. So we're so excited that each and every one of you are here. If you're joining a minute or two late, don't worry, you haven't missed anything yet. We have so far 200 parents on the call. We have 54 grandparents, 93 caregivers, almost 100 home visitors, 150 early intervention specialists, close to 500 early educators. We have about 60 early childhood mental health consultants and almost 50 medical professionals as well. So we have a lot of awesome people who are doing awesome work right now in the state of Ohio, and we're excited to share the expertise of our panel with you and to hear more about what you're experiencing and what's happening in your world during the COVID-19 pandemic. So before we get started, I want to take a minute to again thank everyone for being here. And on behalf of our partners, the Ohio Children's Hospital Association, Groundwork Ohio, and the Ohio Department of Mental Health and Addiction Services, as well as the Vote for Ohio Kids campaign, extend our sincere appreciation for the important work you do every day, but especially right now during the pandemic in supporting young children and their families. My name's Julia Hohner. I'm the Communications and Development Director for Groundwork Ohio, and we're the statewide early learning and health advocacy organization. So we champion strategies and policies that support children from the prenatal period to age 5 and advance a strong policy agenda to support young children, their families, and our communities in the state. And if you see me moving back and forth, it's because I'm trying to read some notes on my phone. So thanks for your patience with that. As we all know, mental health, and especially early childhood mental health, is always important, but especially right now during the COVID-19 pandemic, when we're seeing elevated levels of family stress, when we're seeing increased financial burden on families, and we're seeing a lot of change, that mental health is especially important during these stressful and what can feel like overwhelming times. And especially as we consider our youngest children, who we know are developing at rapid rates, especially between the age of 0 to 5. They're soaking in everything in their surroundings, and the things that they experience during these early years impact them for the rest of their lives. So we're excited to focus on ways that parents can support young children and other caregivers can support young children, but also the ways that they can support their own mental health, because we know in order to fill another's bucket, we have to fill our own first. So we'll have a couple different experts today who are going to share their expertise in this area. But this webinar and these resources are really a result of working closely with the Ohio Department of Mental Health and Addiction Services and the Ohio Department of Health on a resource that we just released today, and we'll be sharing in the chat box momentarily if you haven't seen it already, that shares resources for parents and 10 tips to support mental health during the pandemic. So you'll see in the resource, we have these 10 tips, but we've also shared specific strategies and tools for each of those tips to support young children and families. So we'd encourage you to explore that throughout the webinar and afterward as well. A few housekeeping notes before I turn it over to the folks you really want to hear. Like I said at the beginning, you're automatically muted and your video is turned off, so you don't have to worry about us seeing you or keeping things muted, or if you've got kiddos or dogs running around in the background. You can use the chat box to share any questions, concerns, or comments you have as the panelists are speaking. The attendees can't see each other's comments, but we can all see what you're writing to us, and we want to hear your feedback. The panelists throughout might ask some questions and encourage you to post your feedback in the chat box as well. If you're getting credit for this webinar, so if you can receive credit either through OKRA's professional registry for Ohio approved credit, or through the Department of Developmental Disabilities for early intervention, and you filled out that information on your registration form, you'll receive that within 2 weeks. We'll either send you an email with a certificate if you are receiving the credit for early intervention, or if you're receiving it through OKRA, it will automatically be added into your account with the OPIN that you provided at registration. And then the last thing I'll say is we'd encourage you to fill out the follow-up survey you'll get immediately following the webinar and provide your feedback. That will be really helpful to us, not just in understanding how this went and if it was helpful to you, but in informing future resources and webinars that this group helps to create. So with that, I'm going to introduce our panel. I'm going to introduce everyone at the beginning so we can be most efficient with our time and hearing from the speakers. So without further ado, our first speaker will be Dr. Robert Ammerman. He's a pediatric psychologist and behavioral medicine and clinical psychology at Cincinnati Children's Hospital and the scientific director for Every Child Succeeds. Dr. Ammerman, his work is focused on developing approaches to support parents and young children and optimizing their emotional and behavioral health. After that, we'll have Dr. Laura Maddox, who is the program director for the Center for the Young Child and co-director of online learning and the Autism Certification Center at Ocali. Dr. Maddox has extensive experience as an educator and administrator and has collaborated across state systems within local communities to improve the early care and education of young children. Following that, we'll have Stephanie Davis, the Assistant Director in the Office of Early Learning and School Readiness at the Ohio Department of Education. Stephanie has nearly 20 years invested in working with young children and families, and she currently oversees preschool and school-age childcare licensing and Step Up to Quality, which is Ohio's tiered quality rating system. After that, we'll have Dr. Valerie Alloy, who is the Behavioral Health Policy Administrator, educator, researcher, and practitioner. She has over 30 years of clinical practice and senior management experience and currently leads the Ohio Department of Mental Health and Addiction Services Early Childhood Mental Health Initiatives. Dr. Alloy is also a licensed supervising clinician, a passionate agent of change, and a champion for youth and families and lifelong learning. And then finally, we'll have Erin Lucas, who's the Director of Early Childhood Programs for Hopewell Health Centers. She and her team work to ensure professionals and parents have what they need to grow healthy babies who thrive in Southwest Ohio. It's their mission to ensure access to high-quality integrated care for all, as well as to promote trauma-informed care across systems and communities. So with that, I'm going to turn things over to Dr. Ammerman, and we're excited to share all of this great information with you.
Terrific, and thank you and welcome everyone. I'm going to talk about stress and anxiety and sort of start off with how important it is to take care of yourself and that parents and caregivers take care of themselves for their families. Of course, this is a time of lots of new stressful experiences. Everyone's experiencing them in one form or another. Many of us are disconnected from family, friends, work, school. Routines have been disrupted. There's a sense of not being in control and uncertainty about what's happening next. And of course, many families are also experiencing new significant stressors, such as loss of a job. So when you pull all these things together, this is a difficult and challenging time. And stress affects a lot of different aspects of us. It affects how we feel. It affects how we think about things and how we think about challenging situations. And it also affects how we interact with others, family members and friends and others that we come across. What we want during these difficult times is to be resilient, everyone to be resilient, right? To be able to sort of navigate these difficult situations and challenges, and to try to stay as emotionally healthy as we can be. And of course, we're models for our children. They're watching us and they're learning from us. And as they see us manage our stress and anxiety, they're going to learn from that. Even the very young children are going to sort of soak this up, and it'll be meaningful for them going forward. So the tip sheet has a number of excellent resources I'm going to talk about a few things, specific things that parents and caregivers can do, but I encourage you to look at the resources because there's a lot of good information there. The first thing I want to talk about, though, is a very sort of quick and easy kind of thing that we can do to manage stress and anxiety, and that is deep breathing. Deep breathing has been found to have a really profound effect on the relaxation response in the body. And we can do this very simply. We simply take a deep breath, fill our lungs, and then very slowly exhale. And when we do that 4 or 5 times, we can take a break and sort of move off to the side to do this. We can feel our body actually let go of that stress, and tension sort of lessens. Very powerful kind of technique that we can all use during this time of pandemic, but even when it's over, and it's a great skill to have. A second piece that we can sort of tack onto it is a mindfulness exercise. And mindfulness is all about sort of being in the moment and really clearing our head and our thoughts of those sort of worries and concerns that often happen when we're anxious and feel stressed. And after you do the deep breathing, and even while you're doing it, a good mindfulness exercise is to sort of focus on sort of the different body parts and how they're feeling right now, right in the here and now. Really focus on that tension leaving arms and legs and your neck and your shoulders. That kind of focus also has its own sort of relaxing qualities and can really help you feel better. And also help you think more clearly as you face the day-to-day challenges that are now more complicated because of life during the pandemic. And that gets to the second piece, and that is how we think about the problems and challenges that we face. We know that how we think about these things can affect how we feel and what we do. And we have control over our thinking. We can think about things differently. But in order to do that, what we need to do when we're facing a situation, difficult, challenging situation, the kids are bored, somebody's fighting, we have pressure to do things quickly, we need to take a second, take a step back, say to ourselves, stop. That word is a powerful word because it stops that flow of worrying thoughts. You think about the problem, try to reframe it, recognize it as temporary. I knew someone who, we've all used the phrase, I'm having a bad day. I knew someone who used the phrase, I'm having a bad 5 minutes. Perfect reframing, puts a time limit on it. It's much less overwhelming, and you can begin to break down the pieces of the problem that you're facing and the situation that you're facing, and that will help you to navigate and solve it and make sort of good decisions and make it feel less overwhelming. Another thing that has been found to be really important is gratitude, and recognizing as we worry about things and have concerns about things, we need to really take a few minutes and recognize what we have that is so important to us. And that mere act of just sort of considering what we have gratitude for and what we're really happy to have and value, and even to write it down is even better, can be a powerful sort of shifting of our thinking and our feelings. I'll finish with just a few things about relationships, because since we're all going through this, we're all going to have periods where we feel irritable and might be short-tempered, and when we interact with others, spouses, partners, other family members, our kids, we want to keep those relationships strong. And the way to do that is to avoid criticism, to express appreciation and affection of others. We need to go out of our way to do that, and to be empathic of what others are going through, since we're all facing the same kind of set of challenges during this time. So I will leave to say, take care of yourself. If you do that, you'll also be taking care of your children and your family. We'll go on to the next speaker.
Thank you, Dr. Amerman. And we are going to pull up your slides, Dr. Maddox, right now.
Terrific. So I am going to, as they're pulling those up, I'll go ahead and just say I'm going to talk a little bit about structure, providing structure during these, what probably to many of us are the most unpredictable and times of a lack of structure or completely changing structures. And so the changes in how we spend our days now are leading to new and different routines, different structures, and some of us may be finding that we have very little structure, and especially those with young children at home are looking at their days and saying, you know, what are we doing now? What is our new routine here? And as Dr. Amerman was saying, regardless of other stressors that you may be facing right now, simply living with these changes that have happened and the lack of structure or changes in structure in your life, that in itself has an impact on your mental health and your child's mental health. So, and probably more of an impact than you realize. So because of this, finding a way to create some structure and some predictability in your days is more important than ever for you and your child. So also it's important to understand that routines and structure, they provide security and safety, a feeling of security and safety. And so by having structure and routine in our days, it gives us a sense of control where right now we may not feel like we have a lot of control over where we go and what we do and who we see. So I'm going to give a few ideas of how we can provide some structure in our day with our kids and really how we can enhance the structure of our days to help young children be more independent, to help us get things done that we need to get done, to make maybe transitions or changes a little bit easier, and to help control, and to also maybe create some more fun and build relationships in your homes. Not everyone is a planner, and so that's perfectly fine. I'm experiencing this at home right now. I have 2 kids left at home, and one of them every night wants me to sit down and help her come up with a schedule for the next day to get her schoolwork done. The other one says schedules stress her out and she doesn't want to think about it. She can handle it her own way, and that's perfectly fine. They both have their own way. And what's really important though is to consider, and we do have to do some thinking ahead and to consider what's going to make your day less stressful. And on an optimistic way of looking at that, what's going to make your day more positive and productive? And so think about what you want. Are you wanting to have more time with your child? Do you have work to complete? You know, are you wanting your children to play or get ready more independently? What is it that you're looking for? Do you want help with some of the chores around the house? And so in doing that, I think a good way to kind of shift perspective is instead of right now trying to think of what am I going to do, think about how you're going to do it, because you do have control over the how. So the first strategy that I'll introduce is called sharing control. This is the next slide. This concept means that you're letting your child choose some parts of the activity that they're doing or the order in which they're doing things. You're giving them some ownership within the activities and the routines that you have during the day. And so, you know, when it comes down to it, does it really matter if they brush their teeth first, brush their hair first, or get dressed first? So, you know, it kind of helps with the power struggles or the, you know, independence when a child is able to select how they're going to do things. Are you needing help setting the table? Don't ask a child if they want to help or if they're going to help. Ask them, let them know that they're going to help, and ask them what they want to do first. Do you want to put the plates on the table or the forks on the table? This strategy can be really helpful, especially if you have a little one whose favorite word right now is no. So, you know, it's a way to provide some control, but not not, it provides some choices and control. Maybe after dinner, you ask a child if they want to wash the dishes or dry them off. This allows you to spend time together, they're helping, and depending on their developmental level with these different chores that you have them help you with, or the things that you need to get done around the house, it also provides them with a learning opportunity. I also want to point out that in order to help a child share control, you need to understand their interests, their preferences, things that they like, and what they want to do. And so make sure you're thinking of that and incorporating it into it. So cleaning the living room might mean that you're doing some pillow play. Choices are also a big part of sharing control. So another way to change how you carry out your daily activities is by using rhythmic songs and phrases. So that goes right into the next strategy, which is it comes from a program called Conscious Discipline, and it's called I Love You routines. I chose this one because while it's a great strategy to use regularly, right now during this pandemic, it's especially a great strategy to use. I Love You routines are defined as activities that provide unconditional acceptance. They incorporate the senses. They incorporate rhymes and song, and positive uplifting messages. And there's actually research that shows that they increase the dopamine in your brain, and so they really help calm you and the child down. They build motivation for positive interactions and positive habits. So the next slide just gives some examples of some of the I Love You routines that you might use. The first one, Twinkle, Twinkle, Little Star, What a Wonderful Child You Are, is just a great one to use within any routine. I also included one that's kind of playful and fun, and the third one would be Nice at Bedtime. Okay, my third strategy as I wrap up is using visuals. Visuals can help provide structure. They can also help a child understand what's expected of them. So you can use structures to show your daily activities, your entire schedule. Within activities, you can use visuals, and they really can be used for a variety of reasons. In the examples I have on the screen and on the next slide, you can see one being used for game playing. Now it's so-and-so's turn. So if you're playing a family game, you can structure a whole schedule like you see on the left, or on the bottom with the washing hands, a specific routine. First then works really well because it says, we're going to work on this, and then this is going to occur next. So my final message is just to keep in mind, and here are some more examples of visuals. These visuals are available on our website, the social narratives that are here. And so go to Here to Help at Ocali's website, and you can get a lot of visual supports there. So just keep in mind what's important to your entire day. Be sure that you and your child create a structure that works for all of you and your entire family. Having structure doesn't mean being rigid, but by creating structure, you can include the downtime, the meditation, and even the flexibility so that you can switch things around if you need.
Thank you so much. And with that, we're going to shift over to Stephanie Davis.
All right. Hopefully you guys can hear me okay. All right. Hello, everyone. Again, my name is Stephanie Davis. I'm from the Ohio Department of Education, Office of Early Learning and School Readiness. It says that my video is on. Can you guys not see me?
We cannot, but you just keep talking and I will see if there's something I can do.
Of course, the person talking about technology is having technology. I want to start off by thanking Dr. Alloy and the rest of the team for inviting me to speak a little bit about staying connected during this COVID-19 pandemic. We live in this world of technology that puts tons of resources at our fingertips, so much so that it can sometimes feel overwhelming as parents and caregivers to absorb what it all means to stay connected when we have babies and very young children. As human beings, we thrive on social connection, and we are in a time when we have an opportunity to explore new and unconventional ways of staying connected within our families and communities while maintaining safe physical distance. So what exactly does this look like with your little ones? I'm a mom. I have 2 young children and 1 adult child home with me. And it's been pretty interesting trying to figure things out. And like many of you, we are managing the best we can. I encourage you to utilize the technology that you have and not be afraid to give some new things a try. Staying connected with young children doesn't have to be difficult or overwhelming. Most of us have phones, both cellular and landlines. Many of us have laptops, personal computers, tablets, and for those without devices, there's always good old pen and paper. Even young children can navigate through technology these days with support from the adults around them. The ideas I have to share with you today are all included in the toolkit you received. This toolkit has an abundance of resources to help young children stay connected, and believe me, people are really getting creative out there. One of the most popular ideas that I've seen and participated in thus far is virtual play dates or story times. Even babies can enjoy being read to over FaceTime. If you're in a situation like many who are on the front lines working and unable to physically be with your baby at this time, providing the caregiver with a piece of clothing or something with your scent that your baby can snuggle with while you read that virtual story or sing that song over the phone goes a long way in comforting your little ones while you're away. Google also offers a variety of platforms to communicate. They have apps like Duo and Hangouts. I think Meets is another one of them. There's also Zoom, like we're using today, Skype, and of course, social media are all options for virtual connections. Caregivers, family, and friends love emails and love photos to keep them up to date on what's happening with the children that they can't see in person right now. I've been doing family video chats with my extended family and friends where we play games, and the kids love, to show off things that they've made, their favorite books and toys. Reading with young children is already one of the most important things we can be doing anyway. These virtual platforms offer great opportunities for early learning professionals to interact with their students, as well as grandparents, extended family, and friends. Before the pandemic happened, my daughter attended childcare, and of course at 3, she has no idea what COVID-19 is, but she definitely knew that her normal routine had changed. And so for the first couple of weeks, she would ask me every morning, are we going to Lori's? Lori is her childcare provider. And she just didn't understand why we weren't going to Lori's. We've since then been video chatting with Lori and some of her little friends from Lori's childcare to stay connected. Virtual meals together and field trips can be fun for little ones. I typically travel a couple of times a year for work and have to be away from my children. One trip in particular, I attempted to have a virtual breakfast over Skype with my daughter, who was a toddler at the time. So as I'm sipping my morning coffee, watching her eat cereal, I say to her, ooh, that cereal looks delicious. Are you going to share with mommy? And as requested, she proceeds to feed me cereal through the screen, resulting in her melting down after knocking the bowl of cereal onto the computer and keyboard. Thankfully, both her and the computer survived. I say that to say be careful with those virtual meals. They can get a little crazy at times. Google Arts and Culture has been hosting virtual field trips where children can view museums. There are live zoo feeds into zoos all over the country. InfoHio has resources by age and grade band, as well as educator tools. Something else that's been pretty popular and doesn't involve technology is celebratory drive-bys. My family and I recently participated in a birthday drive-by for a little girl in our neighborhood celebrating her 10th birthday. I got the kids together, we made birthday cards and signs with balloons, and a bunch of people from the neighborhood lined their cars up and drove by the little girl's house honking and waving as she watched from her porch. This can be done for people in nursing homes and just about any other celebration or act of kindness one would typically have that we are unable to do at this point. Pen pals are another great option, full of learning opportunities. I can remember having a pen pal myself in elementary school. Think about the people in your life and community who could use some words of encouragement, and have your little ones make postcards or draw pictures and then mail them or deliver them. Children love sending and receiving emails and mail. Now is also a good time to connect with neighbors. You can look for and create neighborhood scavenger hunts. I saw, I believe it was on the news recently, a community that put together an activity where they put stuffed animals in their windows, and families could go on a bear hunt with their children, finding all the bears in the windows. What a great way to bring the story going on a bear hunt to life. There are also retailers offering support to families. Staples office supply stores are offering free printing of school packets. Charter Communications, AT&T, and Comcast are all offering internet services at a free or reduced price. If you visit www.inmyarea.com, you can plug in your zip code and see what internet providers service your area. They also provide a list of providers who have pledged to not terminate services for failure to pay, also waive late fees, and open Wi-Fi hotspots for people who need them. We are all looking for a sense of balance in terms of communicating, learning, and connecting. The most important takeaway that I have for you is to just keep it short and sweet. As much as we enjoy connection through technology, we must also remember that it's okay and necessary to unplug as well. Choose activities that are appropriate and meaningful to you and your little ones. The last thing that I'll ask of you is to leave in the comments or the chat box things that you've been doing with your family to stay connected. Something that you're doing could help someone else. I'll end by saying, be kind to yourselves, to your children, as we all work toward figuring things out. Hopefully I've shared something that you are using or willing to try. And with that, I'll turn it over to Dr. Alloy. Thank you.
Thank you, Stephanie.
Well, good afternoon. It's a pleasure to be here and joining all of you and my colleagues as we explore this idea of how do we support our children and families and communities during this very unprecedented time. The first thing I'd like to thank are my colleagues who've talked about mindfulness and routines and staying connected, because my job is to now talk more about the idea of communication. And really all of those things are types of communication. There are a couple of preface comments I'd like to lead with. The first one being that everyone around the globe is going through this experience together, this very unusual event. So in that, we are having a shared experience, and our children are as well. And we want to keep that in mind. The pandemic by nature is a type of trauma, and it requires some special attention and special sensitivity. We know that our children are what we call co-regulators, meaning that they balance and stay attuned to your feelings and emotions. And as Dr. Ammerman led with, the idea of the mindfulness and the gratitude begins to set an emotional tone. Dr. Maddox's tips about routine and structure and being planful also begin to help regulate that day and keep us in a better state and frame of emotional mind. Ms. Davis's comments about being connected also serve to regulate us. So while I'm talking about communication, I want to build on all the things that we've been talking about and that you've heard, because it all fits together in a package. As I'm talking, if you are doing things that are unique in terms of communication strategies around the crisis, I invite you to share those in the chat box as well. So I really want to hone into the idea of we adults as co-regulators. We need to allow children a chance to ask their questions And as we think about littles to bigs in terms of maybe up to age 8, encourage them to ask their questions. That gives you, the caregiver, the adult, a tremendous opportunity to know exactly what's going on in their mind, and they can let us know that. That's the first thing. Don't be afraid to ask them, how are they doing? One of the tips I'd like to give you is encourage that. I like the how are you doing, the check-in. And you can check in the morning after mindfulness. You can check in throughout the day on those transitions and those planned activities. You can do that check-in as people go in and out of staying connected. But you can also just ask your child, how are you doing today? How are you feeling? And to help you with that, I've put up a small feelings chart, if we can get that on the screen, as a way to help identify those feelings. There. You can Google many types of feeling charts, but in the simplest form, to say, well, how are you feeling today? Are you happy? Are you sad? The verbal child might be able to articulate it. The less verbal child could point to it. And then once they point to it, there's nothing more to do but then acknowledge that and say, oh, I see you're feeling scared today. Another important thing when you're working with little ones is to get on their level. So to sit, to put them eye to eye on the floor, on the couch, on the chair, wherever you might be in your environment, and be eye level with that little one as you are describing and discussing those feelings. Very important to capture the experience. In the world of the high school student, we talked about the COVID-19 journal. For the littles, we can translate that into a type of scrapbook. We can encourage them to use those feelings to identify in a scrapbook. We can also start to organize those family activities that you've done in a type of scrapbook. But it's really important to capture this very, very special experience that we're going through with the crisis. We also have to help them make sense of their world. And so having that conversation where you are accessible, where you are regulating with their feeling, they are regulating with yours, and you're finding that wonderful point of balance and sincerity and honesty is really going to go a long way to helping you and your children navigate through the crisis. Remember, there's verbal communication, the things we say. There are the nonverbal communications, the things that we do and show, which children are always watching, so keep that in mind. There is the emotional type of communication that happens if we're frustrated or sad. And so we just need to stay in check on that, but be aware that our children are going through many of the same things that we are. The last thing I want to say in terms of communication around children in the crisis is that this is a big unknown, but there have been many positives that are coming out of it. The increased family time that we're seeing around the country, around the state, around the world. The ability to use technology in a way that we had not done so before. The ability to appreciate nature and taking time to be centered is another tremendous outcome, positive outcome of this experience. And it's very important as we talk about children in the crisis and the pandemic that we capture the wonderful opportunities and positives that have come out of this unprecedented moment that we're sharing around the world. With that, I'd like to see if you all have some other ideas to enter into the chat box, and I'd love to turn it over to my colleague, Erin Lucas.
Thank you so much, Dr. Alloy. Good afternoon, I'm Erin Lucas, and I too want to thank Dr. Alloy and Julia for inviting me to participate today. I'm going to share how parents of infants and toddlers can use these tips to promote development and resiliency throughout the pandemic. Tip number 1, children look to adults for guidance. The most important message I have for parents of infants is to remember to give yourself a little grace. Tell yourself, I am good enough. I have what it takes to help my child be healthy and strong throughout this pandemic. You're the expert when it comes to your baby, and you have what they need to promote their development and resilience throughout this time. Tip number 2 is to encourage children to ask questions and talk about their fears. The way we do this with infants and toddlers is to speak the unspoken. Give voice to their experience. What might your baby be feeling or experiencing today? It's okay to say, you're crying. I feel like crying too. I bet it's sad when you hear me talking this way. Or I'm frustrated that I don't have the help I need because family and friends can't come visit. Or I'm sad, your aunt is sick. Or even, I'm mad that I can't go to the stores I want to right now. When we give voice to their experience and speak what they're not able to speak, we give meaning to their experience and to ours. Tip number 3 is to teach children prevention strategies. This is done through modeling with infants and toddlers. As they observe us washing our hands and coughing into our elbow, we're showing them healthy behavior. As they grow, they'll repeat the same healthy behavior. You can support this learning by giving voice to what you're doing. I'm washing all the germs off my hands, or coughing into my elbow keeps my germs from flying in the air and onto other people. Tip number 4 is about routine and structure. And we know that these are critical components to promote regulation, and yet both are so difficult to maintain in the midst of all these changes that have occurred in the world. I encourage you to take a moment to reflect on the aspects of your routine that have stayed the same. What's different? Are there other ways that you substitute new behavior for routines that have been lost? Zero to Thrive has a great resource about the importance of routines, and one of their strategies is to add in new rituals. So adding a few rituals throughout the day can not only promote structure and routine, but it can promote tip number 6, family time, and tip number 9, be accessible. Promoting these concepts with infants means adding just 1 to 3 minutes of routine activity. I'd like to take a moment to practice one of these proposed rituals from 0 to 3 called pleasure gazing, and that'll be shared in the chat box as well. This exercise helps you engage in calm co-regulation with a very young child. Start by taking a few deep breaths. Notice how your body feels. You can use long, slow exhales, or even sigh out loud to help you ease any tension. Now look towards your baby with kindness and curiosity. Notice if they show any signs of interest or engagement. Start by using your sense of sight. Gaze at your baby. What do you see? Use your eyes to look closely at the features of their face with a gentle smile. What are all the colors you see in their eyes? What's the exact shape of their smile? Look at their fingers and toes, the way they curl and stretch. Go slowly throughout this activity, feature by feature. And notice the warm, connected feelings that might arise as you pay close attention to your baby in this activity. You can repeat it with your sense of smell, smelling your baby's neck, and maybe even having your baby smell you. And your sense of touch, maybe feeling their hand wrap around your finger, noticing what that's like. So when could you add a ritual like this into your routine? Maybe when you're dressing your baby, maybe after nap time. What are some other rituals you have that increase your connection to your baby? Is it this little piggy when you're dressing for the day? Or maybe singing a song like the Wheels on the Bus or the Itsy Bitsy Spider when you're driving in the car? Or maybe you read a story before your last feeding of the day to help you and your baby relax. Remembering, as Dr. Alloy said, that babies are co-regulators. And if we can use these activities, not only will it help our baby calm, it helps us too. Remember that each time you do any of these short activities, you're promoting resilience through family time and showing your baby that you're accessible, but also you're creating ritual and routine to your day as well. Tip number 5 is to stay connected. And today you've heard about several ways to stay connected. Ms. Davis talked about the use of virtual playtime, and these can work for infants and toddlers too. One of my colleagues shared that when planning a virtual play date, she and her sister-in-law set up a similar play environment so that they could bring voice to like their shared experience. One of the things they said is like, look at you, knock over the tower. Jasmine's knocked over her tower too. Another colleague shared a strategy that she learned from a parent who's having the family mail letters to her child. Dr. Alloy talked about the scrapbooking. This could be a way that is like not just fun to receive the mail, but then scrapbook and document each person's experience for kids that aren't going to be old enough to necessarily remember these experiences. My sister-in-law created a way for family and friends to sign up to read a bedtime story to her children. And this has become a new ritual for my children as well. They love it when it's their night to read stories to their cousins. Finally, I'd like to highlight tip number 8, self-care. When parenting and caring for infants, it is essential to have a plan to keep caregivers rested and renewed to face the demands of parenting. In the chat bar, we're sharing a tool from NCTSN to help plan for self-care. You heard a lot of strategies from Dr. Ammerman. This tool is designed to help you plan to put those into action. So though it's designed for professionals, it can be used by professionals and parents alike to purposefully plan activities that help refresh and renew you to continue the hard work of promoting resilience in infants. Thank you so much for taking a moment to think about how you're already promoting resilience in your infant during this pandemic, and for considering a few new tools to add to your routine.
Thank you so much, Erin. We do have a couple of minutes left. I'll ask the panelists to all unmute them, or sorry, to turn on their video. And if you have questions for any of our panelists, feel free to submit them in the chat box now. And we can do a little bit of Q&A. We can maybe take 2 or 3 questions. So feel free to put those in the chat box. And while you're doing that, I'll share my ending notes now, which are, if you, so sorry, I'll start with this. You'll be getting a follow-up email. If you're registered for the webinar, you'll be getting a follow-up email later today that will have the toolkit, the link to the recording of this webinar that you're welcome to share with others, and a survey for you to fill out. On that survey will be an opportunity to share if you have concerns or questions about receiving credit for the webinar. You can put those in there. So if you can't remember if you gave us your OPIN, or if you didn't check off that you needed credit for EI, there'll be a box for you to share that information there, and then we'll process all of that together. So I'm looking right now to see if there are any questions. We're getting a lot of thank yous, but no questions. Okay. We're just getting a lot of thank yous. So I guess with that, I'll open it up. If our panelists want to give any final comments or add anything, if you were rushed for time. Okay, I have a question that just popped up in the chat box that is for Dr. Ammerman. Can you provide any thoughts or insights for families who are experiencing a death, and how to communicate and handle that with young children during this time?
Well, first of all, let me say I'm sorry for that experience, and people are having it across the country, and it's certainly a very difficult kind of experience at any time, but particularly with the pandemic and some of the restrictions that we have. The first thing I would say is to seek out resources and help and people to talk to. We know that the grief process is something that works well when people have folks that they can really open up to and have the experience of remembering who they lost. And if professional help is something that's needed, by all means, seek it out. Mental health professionals are now, most of them are routinely providing care through telehealth, so they can now do it remotely, and that's been a really important change in how we provide services. In terms of talking about it with children, being sort of open and honest and sharing your feelings and hearing their feelings, which of course has been a message from all of the presentations, is also important for their grief process. So.
Thank you very much. We're having a couple questions as well from folks who are wondering, during this time when things are very different and there's a lot of media and news exposure, how much exposure, maybe we can have folks speak to both, how much exposure to the media and news is healthy for young children? And touching on that screen time piece, we know we're engaging via screens more than we typically would. Do any of our panelists feel comfortable answering one of those?
Well, I could take a first approach to it, and let's acknowledge the mixed messages we've all received about these things. Keep up and be informed, but don't watch it too much, and be sure to use things like Zoom to connect to others, but don't have too much screen time. So I think we have to acknowledge part of the stress and anxiety is we're hearing different things at different times from different people, and it's hard to sort through it. I think limiting the news for all of us, but particularly children's exposure to it is a great idea. It's often delivered in a very sort of panicky kind of way, and even if they don't always necessarily understand the words, they certainly pick up on the emotional content, which is distressing for most of us. So really limiting that, I think is a great idea. In terms of screen time, sure, there can be too much, but this is a time in which our technology is actually kind of helping us cope with these situations, and just sort of using common sense of not overdoing it and not doing too much of entertainment kind of screen time, but using it for other kinds of purposes, I think is probably a healthy response at this time.
Julia, this is Laura. I can't turn my camera on, so, but I thought I would also mention that one of the strategies I think I did not get to is I was trying to stay in my time frame, as in piggybacking to what you just said, is sometimes using a visual with devices can be a helpful way to help limit that screen time for kids. So, having some kind of a color code or a stop sign and a go sign on a device or on a favorite activity when it's available and when it's not can help with providing some structure to that.
Thanks, that's awesome.
And Julie, I did want to respond. I'm seeing questions about the transition back.
Yes, please do.
We've been having these conversations in terms of summer transition, as well as when we do come back more formally. We think it's important to bring some of the connectedness routines that you've established into that new space. We also think it's going to be very important to maintain the mindfulness and the times for regulating emotionally back in place. Young people are going to be full of excitement. They're going to have trouble with regulation, so we're going to want to make sure that we're building that in. And taking time to recognize that we might not be moving into the formal academic learning as quickly as we might like to, as we help young people transition back emotionally and psychologically into whatever kind of spaces we're going to have moving forward. So just a few thoughts on that.
Thank you so much. I really appreciate that. And with that, there are a lot of other great things that were happening in the chat box, but I want to be respectful of everyone's time here and of our panelists' time. So you will receive an email later today that will have a link to the survey to put in any concerns about getting credit for this, an opportunity to share any insights you have about what resources would be helpful moving forward, whether that's through another toolkit or a webinar or something like that. So please share any insights you have there. And again, the recording of this webinar and the toolkit will also be included in that email. So thank you again to all of our panelists who shared their insights today. and to our presenting partners, the Ohio Department of Mental Health and Addiction Services, Vote for Ohio Kids, and the Ohio Children's Hospital Association. We're going to go ahead and sign off. I know a lot of people are probably going to watch the governor's press conference as well. So we hope you all have a great day, and thanks for joining us.
Thank you.
Mhm.